I would like to call the Health and Human Social Services Committee meeting to order, please. Ms. Bramer, are you all set?
Yep.
Okay, thank you. I'd like a motion to approve the minutes of last month's meeting, please. Supervisor Sokol, seconded by Supervisor Leggett. Any additions or corrections? All right, all those in favor?
Aye.
Opposed? Carried. Chris?
Oh, okay, I'm sorry. I thought I was second today.
You're first in our book.
On the original agenda, you had Office of the Aging. First, Chris.
Right.
You're up.
I would have passed out all the stuff.
Well, Office of the Aging had nothing to bring.
Okay. So I had a few items to discuss this morning.
Okay.
And they're all pretty typical of this time of year for us. In fact, when I looked at last year's May agenda, there was only one item that was different between last year and this year, so it's pretty consistent. The first one is to request a budget amendment to add Trade Act funding to the county budget. This is actually the one item that was different from last year. We have a student who was approved for additional $6,900 in Trade Act funding to continue their education.
All right, motion to 1 and 2. Number 2 deals with the request to amend county budget to add funding to the summer youth program. So we're going to put those two together. Is that all right, Chris?
That's fine.
All right.
Yeah.
All right, motion by Mr. Sokol, seconded by Ms. Globe. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Yeah, if you look at page 4, the details on the summer youth program, most of the money goes into youth salaries. Another is into contract. That's the contract with BOCES that we're going to talk about in just a minute. The next one is a request for temporary positions and training slots. The request is on page 5, but the details are on page 6. This is an annual resolution that we request for not only the youth summer program, but also adult and dislocated worker training funding. And again, it's an annual request. I did put in for a work crew supervisor. The gentleman that did it last year is not available this summer, so it does not look like we will have a work crew this year.
All right, someone like to make the motion? Supervisor Loeb, seconded by Supervisor McDevitt. Any discussion?
Excuse me, Chris,
Yeah.
you just said you will not have
No.
a work crew?
No. For two reasons. One, because the gentleman wasn't available, and it's kind of late to try to find somebody as a replacement. And secondly, we don't have as many out-of-school kids right now as we did last year, so we actually don't have the actual crew.
But they'll be placed?
Yeah. Oh, yeah. Yep. Yeah, they'll just be placed in work sites instead. Yeah.
Any other questions? All those in favor?
Aye.
Opposed? Carried.
The next one is a resolution request for a new contract with BOCES for Operation Food Chain. This is the summer program where we pay for the chef to work with summer youth students to prepare meals and serve lunches at Eastfield. And it's an annual contract. The price actually went down a little bit from last year because we're starting a little later because of the way the 4th of July holiday falls.
All right. Someone like to make that motion? Supervisor Loeb, seconded by Supervisor Bramer. All those in favor?
Aye.
Question?
Question is, which one of these programs is related to the picnic that you have at the end of every summer?
Sort of all of them.
All of them? Oh, okay.
Yeah, well, it's mostly the summer youth program, but we also recognize the year-round youth that participate as well. Yeah. So it's the temporary positions, the TANF money, and then the BOCES agreement.
Thank you.
So we're all in favor of that, right? Okay, thank you.
And then finally, there are 3 members on the Workforce Development Board that are up for reappointment, Mike Perez, Tracy Riley, and John Wheatley, and I was seeking a request to reappoint them.
All right. Motion by Supervisor Sokol, seconded by Supervisor Leggett. All those in favor?
Aye.
Opposed? Carried.
And then just an item for information, on Wednesday, June 6th at 8 o'clock, we have the next meeting of the Workforce Development Board. It'll be at 333 Glen Street on the second floor community room. I don't have an agenda yet for that meeting, but when I do, I'll send it out to the committee, and you're certainly all welcome to attend.
Very good, thank you. Mr. McDevitt.
Can I go back to one just for
Sure,
a second?
yeah.
Okay, the workers who are dislocated due to foreign competition.
Right.
How many of those do we typically have in a typical year, if any?
So we had a lot
You did?
a couple years ago because of the GE closing. All of those workers were dislocated worker. We haven't had a new approval in quite a while. In fact, the person that we just approved additional funding for is someone who's been enrolled in school for about a year. But a typical year, quite frankly, if we have a handful, it's a lot. So it really depends if there's been a big plant closing or not.
Okay. When I kind of think about that, what I immediately think of is the workers we see working at Lake George or Bolton or Great Escape, so that would not be a category where workers come.
Yeah, it would be people, so if there's a large plant closing, like GE, we had an interesting one quite a few years ago where Travelers did some reorganization, and there was one person that qualified for Trade Act because their job was, they were a telemarketer, and their job was transferred overseas because of a reorganization. So, sometimes you get one or two, but more typically it's a large plant closing due to foreign competition. Yeah. It's a great question. Thank you.
All right, any other committee members have a question?
Thank
Supervisor
you,
Lowe?
Madam Chair. On Monday, at our DPW meeting, Kevin Hajos noted that he has, every year, summer jobs, a few of them which carry on into full-time jobs.
Right.
And this year, he has received no applications, but he has contacted you. I just
Yep,
wanted
he
to make
did.
sure that that's...
Yeah, and we actually, we have a youth that may be a good fit. One of the problems is a lot of our youth are under 18 in DPW. They need to be 18 or older. So, we're looking, yeah.
Well, what about, you have jobs program, you have an office
Yep.
in Queensbury
Yep.
for adults.
Oh, yeah.
How do we, I think we've talked about this in the past, how do we make that connection so that everybody says, hey, there's a big boulevard, like a flashing sign.
Yeah. So
6 jobs available at DPW, come apply today.
So one of the things that happens every time there's a new job listing, Civil Service sends out an email, and with a link to the website where the posting is, and we print all those and post them in our office. So when job seekers come in, they see them. It also gets posted onto the job bank, which is managed by New York State, and all of the job seekers are required to register in the job bank to do their job search. So if there's a match there, it would pop up. But quite frankly, one of the real issues that we have right now is with low unemployment is there's a lot of jobs that we just can't seem to fill. And I was at a workshop recently, and I was glad that somebody brought this up. And I may have mentioned this to you, several of you individually. Our labor force, we're down 13% from the peak in 2008. And that's pretty significant when you think about it. And that's Warren and Washington counties. It's the Glens Falls MSA. We lost 13% of our workforce. They're just not being counted anymore. Now, some of that's due to retirement, and some of it's due to people leaving the region. Warren County has lost population, around 1,100 people, and a lot of them were, prime working age. So it's a struggle. Yeah.
Thank you.
You're welcome. Any other questions?
Just that our unemployment rate is kind of in the national norm, statewide norm? We're not terribly low, are we?
But we will be in the summer. Right now, and I can't remember what the rate was the last month, but New York as a whole and Warren County as a whole, we have been tracking a little less. Our rate's a little lower than the national average.
Supervisor Leggett?
Yeah, just to clarify, we've lost workers,
Yeah. Yeah.
so the number of available working age persons has decreased since 2008.
By 13%.
Which is how many number? Thousands?
Yeah. I think the size of the labor force, I'm guessing, I can't recall off the top of my head, 50,000. So yeah, it's significant. I can send you the data.
Thank you. Yeah, that'd be helpful.
Yeah.
Just
It's right on the Department of Labor website. It's the official labor force data.
All right, any other questions? All right, thank you very much,
Yeah.
Chris.
Yeah, you're
Have
welcome.
a good
Thank you.
rest of your day.
Yeah.
Thanks, Chris.
Social services?
Wow.
You were in today safer?
Yeah.
Well, that's more than
Morning, folks.
Morning.
Good morning.
Thanks, Chris.
Good. Yep, she was right involved.
No, I don't have it.
We're all set, whenever you're ready.
All right, good morning, everyone.
Good
Morning.
First thing I'd like to do is, I had said that I was going to start bringing over some of my staff over there once in a while to introduce them to everyone. Today I've brought over our confidential secretary, Joanne Collins, who is extremely helpful and very pleasant to work with as well. As you know, Edna.
Yes.
Yes, she's definitely a big asset to the department, and we enjoy working with her. So I know some of you have met her before, but if you haven't,
Nice to meet all. See you
Thanks for
full
coming.
faces again. I appreciate the opportunity. It's busy department.
we appreciate having you over there, as you know. Thank you.
All
right.
She's a big help to you, Chris, I'm sure of that.
Yeah, she has been a very big help, and especially with the transition, because she had a lot of things in place that she really knew about, so she's been an extremely good resource to have over there, so we're thankful that she stayed on, and hopefully will stay on for a long time.
Okay, sure. Thank you for being there. All right, Chris?
Okay, the first thing that we have are some requests here. Number one is a request to create and fill a social welfare examiner position for Heath. This is a position that we've had some temporary employees who would usually do this work, but it's really developed into a year-round type of position now, and there's a lot more work and applications. So one of the things that we did was we looked at some of the costs and would it make sense to make a permanent position, then we would have less in the way of temporary workers, and we'd have a permanent person who could handle this work year-round and also be helpful in training temporary workers and other workers that might work in that area from time to time. So the position would be examiner number 44. It's a grade 8 entry-level salary would be $34,102. So in regards to that, this would also, as I mentioned before, reduce the number of temporary HEAP employees that we have to hire when the season gets really busy. We had close to 4,000 applications overall last season, so it's quite a volume of work. There's an attachment, number 1, that outlines some of the details as well.
All right, would someone like to make a motion, bring that to the floor? Supervisor Loeb, seconded by, right. Kramer. Did you have a question?
I do, yes.
Go ahead.
Thank you, Chairwoman. Is the reduction in the use of the temporary staff going to balance out the cost of the new position?
It's going to be a little bit different. I think Julie can speak to that. We've talked about the numbers, but she probably have more specific details.
It's going to cost us more, but because he has fun year-round, there's a cooling element now. We have cleaning and repair that is year-round, and they're going to try to do the bulk bit during the summer or the heating part piece that starts up. So we are anticipating a higher allocation from New York State.
Oh, okay.
Because of this, however, I don't have the allocation yet. But we are hoping we'll offset the additional amount. With health benefits, because the full-time positions are qualified for health benefits, we're thinking approximately 20 to 35 years, depending on what option they would, is an actual net income. Yes. Are we looking at the meeting and the temporary positions? Is that a thing? Our temporary right now, what happens is we hire them for the initial season, which used to be in September. And then we're allowed to keep them for 6 months, but we would always have to extend it because, like, the very last day that the heat season was open for heat, actual heat in the winter, we got 85 applications in one day. And at that point, we can't let them go. Somebody has to process all of these applications. So what would happen with the heat is we would have to ask permission to extend that temporary, at least usually 2 positions we would ask to extend, and then for one of them even beyond. So it was getting so 2 of our heat people, we were actually keeping 9 to 10 months anyway. So we're expecting to not have to extend them at all once we have 1 full-time. My question though is, are we going to delete one of the temporary positions? Absolutely. Yes. Yes. So do we need a separate resolution for that?
But to delete
No,
the
we don't do a resolution to hire our temporary examiner. We never have.
Okay. And so we don't need a resolution to eliminate a temporary. Is that what you're saying, right?
Correct.
Okay.
Yep, we usually just hire 4 in August to start up in September, and we will only be having 3 temporary. Right, and my question is, are we going to delete from the table of organizations one of the temporary? Because what I don't want to happen is that we create this position and you still fill all 4 temporary positions. I don't want that.
Yeah,
No,
we won't be doing
won't.
that. We definitely will not be doing
No,
that.
the 1 full-time will more than one of them temporary. However, we need to do it. We need a resolution to change the table of organization.
Do you know, Joanne?
I'm thinking, Julie, that last year we changed our heat positions to individual positions rather than the bucket. that you're thinking
Oh, we
of?
did.
So I think you do have to delete one.
Okay,
I think we have 1, 2, 3, 4,
we do.
and just delete one of those, and that can be on the same resolution.
Okay. Delete number 4, okay.
So are we going to make
Yeah.
that part of this resolution then?
Yeah.
All right, so then for those of you...
I will amend my motion.
Yeah, me
All right,
too.
and second to that. All right, any more discussion? Supervisor
Just a
McDevitt.
general question. You indicated you had over 4,000 applications. We have a population in the county of 65,000 people. That would be like kind of a 7% number, which wouldn't be a good number because we're really heating structures, residences. So I guess my question is really general. Is the HEAP program, in terms of number of people we take care of in Warren County, is that kind of typical of kind of counties surrounding us? I mean, is it high?
It is typical.
Yeah.
The requirements are similar. So on a percentage basis, it's typical. That also does not only include resources allocated for fuel, but it also includes cleaning and repairs as well. So we may have, multiple applications for one person based on their needs. So it is typical, and it has been going up. There's also an element to this that's being linked to SNAP now. So we're going to have some increased work in SNAP because they are increasing, I think, the amount of benefit to SNAP, people who get SNAP who also get HEAP. So we're starting to learn a little bit more about that. The supervisor of that area has informed me that this definitely will be coming because it's a new change. So that's another reason why it will be helpful to have a year-round person in HEAP because they will be able to help with that a little bit as well, that transition.
One more comment too. People are also going to community action to get
Exactly.
assistance with heating. That organization does go into people's homes and help them, like, tighten down air situations so they're not having drafts in the house. And so there are a lot of people who are working hard and still in need of help.
Any other questions? Supervisor Leggett?
Yeah, so on the funding on 110, you have that amount to cover in the salaries then already. There's no budget adjustment needed.
I'm counting it based on positions that have been empty
Okay.
for the first few months.
Okay, good. And it'd be coming out of some .8s as well for benefits.
Correct. And again, positions that have been empty, also their health insurance, and that haven't been utilized either.
All right. Okay to vote on it? All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. The next request that we have is to reclassify and fill a position in our legal unit. We had an intake clerk who was recently promoted to a social welfare examiner. And when I became commissioner, I started looking into, I was already aware that some of her functions had changed and evolved into a much different job than maybe would be typical for an intake clerk. So when I reviewed that, I found that her position really was more of a secretary legal position. So we've been working with civil service to reclassify that as a secretary position, which is the same grade, so there would be no change in funding in regards to salaries, et cetera. So we're going to remove the intake clerk number 6. Our request is to remove the intake clerk number 6 and to reclassify that as a secretary legal position.
All right, Supervisor Sokol, we make the motion on that. A second by Supervisor Leggett. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Number 3 is some notices of intent for us to fill some vacant positions. The first one is support investigator number 4 in child support. This position was vacated due to a promotion in March. The next one is an intent to fill senior caseworker number 3 in the preventive unit. That particular senior caseworker was promoted to the foster care supervisor, so that position became vacant at that time. We're requesting to fill that position. The next one would be a caseworker backfill due to promotion. The name and effective date would be determined because that would be the caseworker that would be promoted to fill the senior caseworker position in preventive services.
All right, let's
I'll
bring...
move all 3.
All right, all 3 is second. Supervisor McDevitt, any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Number 4 is to request a resolution in regards to renewing a contract. That would be the Council for Prevention of Alcohol and Substance Abuse. This is for the Youth Court Program for a period from January 1st, 2018 through December 31st of 2018 for a total amount not to exceed $68,820. This is a program that's been very helpful to youth and our community over the years. Benefits Warren County and surrounding communities because the youth, instead of having to go through certain criminal proceedings and other things that might be not as conducive to improving outcomes for them, they're able to be in this program, and it develops them through, community connections and further involvement with the justice system and, further possible activity that might land them in trouble. So it's a very good program, and we've been supporting it for a number of years.
All right, someone would like to bring that motion to the floor? Supervisor Lowe, seconded by Supervisor McDevitt. Any discussion? Supervisor Leggett.
Thank you. January 1, 2018 is the start date?
Yes.
Have we been in contract with them to date? We're in May.
Mm-hmm.
Was there a lapse in the contract?
Actually, what happened here was, we were waiting for the state delegation, and
Okay.
because since it's state, the local share, well, technically we wait until, the state funding is allocated and, get this approved. And our state allocation just came over.
So this kind
We
of
are
happens
running
every
like
year
this.
then, right?
Wondering why that. Okay. Thank you.
Okay. All right, any other questions? Supervisor Lowe.
Madam Chair, this is a fantastic program.
Yeah.
Just wondering, every year we go through a normal budget process in the fall. How does this dollar amount fit into that, what we vote on in October, November?
It's under my contract in our youth bureau budget. And for the county share, what's not paid by the state grant that we get, we claim against our STSJP grant, which covers another 68%, I think. So that the bottom line is, for the county share, it's very small. Overall, if the total contract's almost $68,000, I think the county share ends up being around $10,000 to $12,000.
And you have that covered in your budget?
We do.
Right,
Yeah.
okay. Right.
Thank you.
Okay. Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Number 5 is a request to reappoint Susan Shepler from the town of Thurman to the Warren County Youth Board for a period from January 1st, 2018 through December 31st, 2018.
All right, Supervisor Ahsoka will make the motion, seconded by Supervisor Leggett. Any discussion? Supervisor McDevitt?
Can someone talk to this issue? We have a representative.
Well, she was at the first meeting that we had, right, Chris? We had a meeting, was it
Right.
April?
Yes.
And she was there, so she must have been aware that that was going to be her position, correct?
She's the only one in office.
Oh, okay. But I knew she was there at that meeting in April, so,
Yeah, she was in attendance.
right, so...
You feel comfortable with the...
No, but that's decidable.
Oh, boy.
That's good, go ahead.
Okay, we'll vote on that. All those in favor? Aye. Opposed?
Yeah, I'm going to oppose it.
Okay, 3 against, so what do we got? 1, 2, 3, 4 in favor?
Can I just make...
Certainly, go ahead.
I'm opposing it, not because I know nothing about it, and I asked the question just for, I assumed the representative from Thurman was going to say, yes, of course I enthusiastically support this person. That's kind of normally how the process works, okay? But we're from Thurman, right? So we just,
Hey, last year she was working for our youth commission, and she, in the minute the former supervisor quit, she quit.
okay, I guess
So you don't-
my point
You
is
don't care about kids if you quit.
that this could be the best human being known to man, okay? But I guess I don't know at this point. So that's the reason I'm voting no, because I just don't know.
All right, Supervisor Leggett?
The town boards put these forward, don't they? Pass resolutions supporting appointments to the youth commission?
In our town, we did,
Yeah.
that the board has to approve it.
Yeah.
It can't just be by one person.
They approved it.
Okay.
The town board.
And Chris, what do we meet, like 3 times a year?
Yeah, it's not very often.
It's hardly anymore this time. I don't think there's very many more meetings this year.
No, we have one in September, and I don't know if, I don't know if we have
And
any
the next
after
one's
that,
September,
so...
and we'll schedule the next one at that meeting, probably.
Right. So how are we on the vote? Okay. All right, so that one was approved. All right, then, thank you. We'll move on, Chris, to the next items.
Thank you. We do not have any pending items, but I just have a couple updates. In April, I met with Chris Hunsinger, and we discussed services, including the summer youth program, and he gave me a nice tour of the facility down there. I hadn't been in that building in quite some time, so it was nice to go down and meet some people and see what they're doing. On May 3rd, I met with the family court judges and their staff to discuss some issues and ways to improve the processes, not only in family court cases, but with child support unit issues with the magistrates as well. We completed our social welfare examiner backfills, which was a big issue when I first came on. We had 5 openings, and we reorganized the units to improve efficiencies and workflow, and that seems to be going pretty well so far. It was quite a project for them to do, but they've got it where they want it now, and I think it's going to be much better. I conferenced with our support unit supervisor, Lori Mosier, in regards to how our legal team is handling issues in front of the magistrates, and we're working on really changing the way we do that process based on some information and research that Lori did with other counties, and based on some input from our family court judges as well. So we're working on that to improve that too. May 9th through 11th, I attended the annual commissioners convening at White Eagle in Hamilton, New York, which was really nice. I got to meet other commissioners, some of whom I had met before, but most of whom I've never met before. They were very welcoming and gave me a lot of support and ideas, which I took back with me. So that was a really good experience. In May, on the 17th, Warren County hosted compassion fatigue training. We had a really big turnout, not only from our county, but other counties and agencies as well. I'm working on trying to get that back because the feedback I got was just really tremendous. I did go in and met with the instructor who was very gracious to inform me of some things that were coming up, and we might actually possibly be able to get him to come back in the fall to work with other staff in our building. It was really good training. Everybody was raving about it. And just a reminder, tonight at the Wood Theater is the screening of I Am Jane Doe. It's about sex trafficking survivors, and that will be at 6:30. Tomorrow we are having a symposium. We're not having it, but we're supporting it and have facilitated this at the Georgian. It's called Hiding in Plain Sight. It's about human trafficking and sex trafficking and the like. So that will be a very good event. So I encourage people to try to get to those.
Right, thank you. I appreciate your bringing us up to date on what you've been doing. I think that gives the committee members a better idea of what's happening over there, so I appreciate that.
Thank you.
And I guess is it up to Julie's turn now?
Revenue and expenditures really on target for 4 months into the year. In both expense and revenue, I don't have any there.
Okay.
And our overtime and high, we've got what, 3 caseworkers in training. So that they all involved in overtime. Our on-call workers have been extremely busy. I got a phone call from payroll asking if there was being entry error for overtime because we had one caseworker on open weekend. That's all she did. 30 hours overtime in one weekend.
Oh my word.
They thought maybe it should have been free, that we keyed it wrong. It's like, no, we didn't. Just an incredible amount of phone calls coming in that needed to be addressed. Hopefully that will continue, but we have no.
Supervisor Conover, I assume you have a question regarding that?
It would be helpful, I know you have this on a spreadsheet, if next to the 2018 column year-to-date, to put the 2017 year-to-date, so that would help, very helpful. And also down below, where you have the year-to-date revenue, 17 year-to-date revenue, and that's helpful too, because I know the revenue comes in at different times, and you can take a quick flush on that, you might say, well, we're ahead or behind on the revenue, but it doesn't come in at different times, so, but if you have it year-to-date, and I see you have the expenditures month by month, so I assume that is a simple Excel macro to bring it over, and that would allow the supervisor at a glance to be able to see year over year where we are.
Thank you. Anything else, Julie? Okay. Then I guess it's Edward. Yes. Go ahead, Supervisor Kramer.
Thank you. This is a little bit out of the blue, but I'm wondering, have we had any audits from the city? Corporate audit or financial audit?
I had one the week of June 18th on financials. Yep. Every year. It's very, very sporadic. They do different programs different times of the year. The one in June is on medication. The month now we get a call that they're going to be doing food stamps and foster care. So we're always ready for it. Then at any time. They usually give us a month's notice, and then we pull any. Usually they pick specific states to so that they can review it from start to finish, from, intake to payment. We have everything pulled and ready for them, and so far, and I've been putting these audits and once in a while, they'll come back with a letter stating something that they might want us to sign to week, but overall, we've never seen a real issue. Yesterday at a meeting when I brought it up, we're supposed to talk about positives, so when I mentioned that we had an audit, everybody's like, that's not a positive, and it's like, well, it's really not negative either. I'm really comfortable with them.
No, I think they're positives with the results that we've been having.
Yes.
And I can add to that, the financial side of things, obviously Julie's more involved in that, but in the past, one of the biggest areas that is audited in our department is foster care claiming. So we have to be compliant with Title 4E and TANF regulations in order to get the funding, so we quite frequently have audits on that. Unfortunately, the overall audit is based on the state's performance. So if we do great and a couple other counties don't do well, it can affect things. We've never had an issue. In fact, our claiming was, we actually revamped this whole thing a couple of years back when I was in foster care about how we process our 4E claims, and we had actually got a letter from the state declaring, that we were the first county to ever be this consistent and have 100% accuracy and funding for our foster care cases and adoption cases. We also had a rather extensive review of our cases in regards to casework practice, which is separate from the funding aspect this past year. And we spent 2 days in Albany, and we received notification that we were in substantial compliance, and there were only very minor concerns which were not something that would affect an outcome of a case or technically really be considered deficient. It was just some document. The work had been done, it just wasn't documented in a way that was very clear in a couple of cases. So we've since tidied that up, but we do get audited in all areas of DSS on occasion, especially in areas where there's funding streams that we have to access. And there's also a lot of regulations. And one of those areas, of course, is in foster care and adoption and CPS. There are a lot of things that we have to make sure that we're doing. And I'm happy to report that we really have not had any issues in those areas. We've had really good outcomes. So thank you for your question on that.
Thank you for explaining that to us, Mr. McDevitt.
Well, quick question. You were mentioning foster care children. How many foster care children do we have in Montana?
We have around 40 right now, plus or minus a couple, depending on what's happening in family court, which is lower than we've had in the past, which is, a good thing. We've been up to close to 80 at certain times over the last few years. But each year we seem to be going down a little bit. I think we're going to see an increase with Raise the Age. And, there's always, ebbs and flows to, what happens in the community that might affect foster care as well. As you know, the opioid epidemic has affected it a little bit. Fortunately, it's not been as severe recently. Not that it's not a severe epidemic, but it hasn't been affecting foster care rates a lot recently in our county.
Thank you.
Ready?
Welcome.
Thank you. Edward, go back to you. Thank you.
I'll email you and then you'll have it.
Hey, good morning.
Good morning.
First item I have is a request resolution. Request a renewal or a contract with Mahoney Notify Plus for a security system, the period of fire alarm security system for the period of August 1st, 2018 through July 21st, I'm sorry, that's 2019, typo there, for a total amount of $1,133 per year, which includes the semi-annual inspections, which come to $342 a year, and also includes the alarm monitoring as well, a total amount not to exceed $1,475. Coming out of the budget code 6030-470, and the rationale obviously is to provide fire safety services to the residents and staff.
All right, someone like to bring that motion to the floor? Supervisor Bramer, seconded by Supervisor Leggett. Any discussion? All those in favor?
Aye.
Supervisor Leggett.
Sorry, it came up last year that
Right.
they had recommended other things for the system. Is that still on a recommendation? Have you done anything for that?
They haven't mentioned anything. All I can say is that the system is working, you know, it's functioning the way it should. It is aging, it is outdated, but it's functioning well, and, you know, it's doing what it needs to do. So, we don't want to spend money unless we, you know, obviously, absolutely have to.
Thanks
Okay.
for that update.
All those in favor?
Aye.
Opposed? Carried.
Thank you. Second item is a request resolution to renew the contract with our consulting dietitian Jennifer Linehan to provide dietary services for the period of March 1st, 2018 through March 1st, 2019, a total amount not to exceed $3,840. Again, they're coming out of the budget code 6030-470, and she provides nutritional assessments and other dietary services for our residents.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion? Supervisor Bramer.
Okay, what is her hourly rate?
I believe it's $40 per hour.
Any other questions? Okay, all those in favor?
Aye.
Opposed? Carried. Thank
Thank
you.
you. Okay, then, I don't think we have any pending items, and then I did include the overtime report through the middle of May. As you can see there, you know, we are bringing it down, trying to minimize overtime as much as we can. I know we're over for the year, but the last several months have been an improvement from the first quarter. In the first quarter, we had people getting sick, we had, you know, holidays and so on, so, you know, that's improving. So you can look at that for the overtime report, and then the last item is our census report. We currently have 33 long-term residents. That's it. If you have any questions, I'll be happy to...
Any questions from the committee? Any questions from the floor? Supervisor Garrity.
So, say to Chris, and that group over there, that we met with veterans, and they're very pleased.
Oh,
Veterans.
Good, nice to hear that. Thank you.
Positive feedback.
yes, we were pleased to hear that.
Thank you so much.
All right, anyone else? Supervisor Beatty?
Yeah, thank you, Madam Chairman. So the overtime report that I'm looking at, so we're up, last year at this time, we had 314 hours overtime, this year 511. And so I understand sick time and vacation, from my experience, you know, you can't put exact time and a half and all that, but normally they, you know, you don't see a huge spike or a huge dip. You see, you know, somewhat up a level. So there's going to be a little bit more to that. You know, we're up 200-something hours, almost 200 hours, which is at about 40-50%. So can you give me a little bit more analysis on that? I mean, that's a huge jump.
Well, I think one of the main reasons, as you can see, if we go back to January 7th, okay, a good bulk of that was there in January. And the reason is that for the week of January 7th, in 2018, that payroll would be where we had 198 hours of overtime, included 2 holidays, Christmas and New Year's, where in 2017, it only included 1 holiday.
Okay, that makes sense then. Okay, that's part of it. what else? That, I can see that, there's an extra holiday in there, so.
Martin Luther King Day, what was going on with that day? They also had two positions, one without, on workers' comp, and one without, what, so two long term.
Okay, so now it's starting to get a clearer picture. So you had a workers' comp case and a medical case, and so obviously you got to fill the position, so it's creating overtime for the people. Okay. All right, so that's giving me a better picture of this. Okay. All right, anything else you want to add?
Well, just basically, some sick time in there as well, during the winter season.
Did you find that this winter season, I don't want to track it, did you find that this winter season was more harsh than past winters?
Well, actually, ironically, as far as the staff getting ill, we actually, it seemed to be, we had less sick people this past winter than the previous winter. But as we got into the spring, we had more staff illness, so we weather starting to warm up. So, I don't know, that's an anomaly. It's really hard to explain. Because, the past several months, more people are getting sick, but we have less overtime. We did hire, we have hired, some temporary people, per diem people, and our plan going forward is with the summer, so much vacation time will be taken. Our plan is that we intend to hire 2 part-time per diem people and train them as aides, so we can use them, people who work less than 40 hours a week, so we can use them to fill in not only sick times, but also benefit times and vacation times, so that we don't, we can minimize overtime there too. So that's our plan going forward.
Okay, and one follow-up question if I may, ma'am. We got 33 long-term residents now. Give me a little gauge, is that up, down, what's normal?
Well, when I started there in January of 2017, we had 35. About a year ago, we got down to 28. We had a meeting with Ms. Frazier, and we put together a plan on how to turn it around. From a year ago, when we had 28, we got up to 35 in December, and now we're down to 33. So all I can say at this point, it's a tough question to answer in 25 words or less. We are working our plan, but there are significant challenges that we're facing and a lot of specific nuances that we're running into. So what I would suggest, as I have suggested before, I would be happy to meet with you. If you want to come up, I'd be happy to meet with you, go over the specifics of our plan, discuss the challenges we're facing firsthand so you know exactly what's going on. Or the other option would be I could send you a report. Maybe every month, this is what I did, this is what I encountered, this is where we're at, to drill down on all the specifics. So whatever you want to do, I'm open to do. Just tell me and I'll be happy to do it. But that's a difficult question to answer in 25 words or less.
Yeah, I was just wondering what the trends were. That's
right.
So yeah. I'm fine with whatever the committee wants to do. I mean, if you wanted to send me personally, if the committee didn't want to handle other information, just what difficulties you're running into, or what, I'd be glad to read it.
Right.
But I don't want you to spend hours making reports up for me.
I don't mind that, because it is it's a concern, it's an issue. So
Right.
it deserves time to be invested in it. So I'll be happy to do it. And for anybody else. Just
Well, I was
let me
going to
know.
say, Edward, if you're doing it, you might want to just send it out to the committee as
Sure.
well as to Mr. Beatty, and then they'll kind of be up to speed on what's happening.
Yep.
So if there are no more questions,
I'll be happy to do that.
we're going to move then on to the next meeting, and I'd like to thank Edward and Julie, Chris, and Joanne, and we'll see you next month.
Thank you, everyone. Have a
Thank
nice
you.
day. Yep.
Oh, he is. He's working hard. That's not easy.
In today's Post-Star?
Do that.
It's in the paper as well. There's a council person up there.
Anything else?
Basically said,
Good.
he says something like this, he says, it's kind of graphic, okay?
Oh, no, don't read it, I saw it. He must have,
Believe that he somehow tried to appease tried now, apparently.
Oh, okay.
But it,
Get real. But what, to make it go through.
Thought it would. Oh, of course, I know Susie or Charlie, good person. That's normally what happens, doesn't it?
Right. No. Yeah, I saw that, yes. That's
Look at me.
We're all ready whenever you are, Janelle.
Welcome. The first resolution request is to approve Health Services updated corporate compliance policy with amendments noted within. This is attachment 6. For the purpose of the packet, just because I know it was distributed with the agenda, I only did the first couple pages versus 18 or 19 with the packet for today. But due to our recent administrative staffing changes, our department's corporate compliance policy had to be updated. We discussed at our corporate compliance meeting, the verbiage basically designating our corporate compliance officer was changed. Instead of designating certain individuals, we went with a more as designated by the Director of Public Health and Patient Services. In addition, our policy was amended to reflect the Human Resources Director, who was named in the overall Warren County Corporate Compliance Plan. So,
Someone like to make that motion? Supervisor Sokol, seconded by Supervisor Leggett. Any discussions, any questions?
In reading through this, I'm thinking the board of supervisors should come up with a corporate compliance. Well, but, yeah.
All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
okay, the second resolution request kind of follows up on that. This is for the overall Warren County Corporate Compliance Policy. So this is to approve the Warren County's updated corporate compliance policy with the amendments noted there within. As a result of the anticipated retirement of the county's current corporate compliance officer, Joanne McKinstry, Warren County's corporate compliance policy was also amended to name the Human Resources Director as the corporate compliance officer, and this is an attachment 7.
All right, thank you. Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Lowe. Any questions? No discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
All right, the next resolution request is for a budget amendment to amend the 2018 budget to adjust the Health Services Home Care Division to reflect $18,043 received from Adirondack Health Institute. This is on attachment 5. Tom, do you want to do the rest now?
We've been getting disparate money regularly from Adirondack Health Institute, and we got on April 26th a letter stating that we're getting an additional $18,043, so I just need to amend the budget to add that. All of this money at this point has been earmarked to go towards our new crescendo as we move towards the software and hardware for the billing department for home care.
All right. Supervisor Sokol made the motion, seconded by Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
All right, the next resolution request is to renew a contract with the New York State Department of Health Health Research Institute to allow for continued funding of the Emergency Preparedness Program for the period of July 1st, 2018 through June 30th, 2019 in the amount of $52,096. The grant funds the staffing that we use to meet the New York State Department of Health deliverables required for our Emergency Preparedness Program. There was no increased funding from last year.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Leggett. Any discussion?
This is for bioterrorism?
When this grant first came into being, it was called bioterrorism because we were worried about the smallpox, the anthrax, and the such. Since it's gone on to include chemical terrorism, radiation, and weapons of mass destruction, so now it's more broadly emergency preparedness, but yes, it's one and the same.
That was feeling good.
All right. All those in favor? Aye. Opposed? Carried. Thank you.
far as pending items, there are no pending items at this time. There's a lot of information for discussion and review. First being the report of expenditures and revenues and overtime for per diem use for 2018. That's on attachment 2, and then we'll also discuss revenue and expense comparison report for 2017 versus 2018, which is on attachment 3, and Ton will.
Attachment 2 is our current fiscal and financial, like I said before, 2017 is all closed, so those are final numbers. Again, bring to attention our salaries, we always like to compare those. We are at 28.96% of current budget, whereas this time last year we were at 33.33% of current budget. We are down in overtime, and we are down in part-time salaries from last year. However, our regular salaries are up, and that has to do with both increases in the contracts that we expected with all of that union. And then also we've had some retirement, so of course that affects the bottom line, but still overall, keep in mind we are under what we were last year at this time. And attachment 3 is also basically a comparison, like they say, apples to apples instead of opposed to year to date. And as you can see, I ran the general ledger the same date last year to get an idea. They showed you the salaries information. Our equipment was not, that was basically the differences with some vehicles that were purchased earlier. We'll be getting some vehicles, by the way, by June. We have 2 budgeted for this year, and they're anticipated to be received by June. Contractual, which is our expenses that we pay everything with, it's down, but when I was doing some comparisons, the majority of that is still within our preschool program and our home care program where we pay our therapists. It's just timing when I look at the comparisons to date. And same with our preschool program, again, those bills just coming in and again, comparing those dates. So that'll catch up a little bit. Revenues, I will tell you, at least with our home care, there, and you'll see with the referrals too, we're pretty much even where we were last year. So that's staying the same. Right now it's showing that we're about 33,000 above last year overall, the whole for our department. So right now we're staying pretty much even. So.
Thank you. Question, Supervisor Lowe first.
Is there anything, we look at the numbers and they up and down, they match last year, but to be specific, are there any areas where positive or negative, there is cause to raise your eyebrows?
Not, I mean, where in the past it was when our long-term care program was last, when you compare the year before and the current year, we didn't have the revenues that we did in the past year. So that was, what we were always able to claim that was because of it. When it comes to anything with regards to public health or anything else, again, it's the same right now. Again, with preschool program and early intervention, it depends on how many children are referred. And like I said, it can be expensive with, depending on what the services the kids need. Right now, no, nothing at this point. At year end, it does look that way only because of, again, timing in the preschool program with the state. We don't get all the information till the next year. So that's why when you guys ask me around March or April, we're just getting all the numbers in, so we can't close it here, but now that that's closed. Yeah.
I understand it looks that way. That's why I asked the question.
Yes.
Because, for instance, social services, they say they have a certain amount of revenues that come in by the end of December, and then a pile of them don't really arrive until almost March.
But the difference is...
does it look like, oh, geez, we don't have all this money, but...
Well, it depends on if they're looking at it as a cash issue or the way we work it in the county, it should be an approved issue.
It doesn't matter what I'm seeing here. Are you going to go home and say, holy moly? Thank goodness the Board of Supervisors didn't ask this question. The numbers look okay,
I'm not
but
going to...
we're really concerned or we're really ecstatic.
No,
Okay, you've answered the question. Thank you. Thank you.
Supervisor Leggett, I saw your hand.
Sure. Salaries are up 34,000, benefits are down 35,000. That's due to you said that was due to retirements and such as, so we're paying out salaries.
Well, when someone retires, their, what they call their cash out or their last check, they get whatever their balances are, if there's anything. I can tell you a few people retired have nothing to cash out, and a few people have. So that's, and again, as retirements keep happening, you're going to see that. Our next one isn't due until I think June. But again, I don't expect a big cash out there. So that little bit is what is probably what's sending over. We are filling full-time positions. Our per diems are still working for us. And again, that's where we save in benefits. benefits, that we're not paying benefits, per diem, and no benefits as in, well, it goes to retiree health. One thing to keep in mind, when someone retires and they have health insurance with us, it goes from the health insurance line over to retiree health insurance. So, our home care is the biggest one, because there's most people in there. But that expense gets shifted, and so if we hire someone to replace that nurse, we still have to pay health insurance, and we'll also pay retiree. So, I'm just going to say that, you know, I was doing an analysis trying to look at the retiree health. We really are getting hit over the last few years with people who've been here, and I'll say 25 to 30 years. So we've had longevity. Last year was close to 220,000, 219,000 just in our home care that are paying retiree health for a year.
And is that showing up in your 800s here? Or
Yep.
That, oh.
Yep, it's been yep. You're welcome.
All right, continuing along with informational items, emergency response and preparedness, we have attachment 1, that's our monthly report of activities. Status of referrals is attachment 4 that I'm happy to kind of review. Val and Tammy are not here today due to our crescendo training, so we are providing teamwork and covering. So if you look at the report, if you see back in March of 2018, it looked like we were down negative 37% for referrals. That could be quite alarming. But if you go back up to the middle row, in the middle of the page, and look at March 2017, you see 169 referrals, and if you kind of look at the trends for the whole year, you see that that was kind of an outlier at that point in time last March. So then when you kind of look at our March number here, it's more in line what we're used to seeing. So it's really not as horrible as it looks. We also try to reassure ourselves when we go to home care meetings and the hospital meetings to try to see what's going on with their referrals. And so usually if we see a dip, we want to be sure everybody else is seeing a dip too, and that kind of is a common practice. We haven't really seen that our numbers are far out from what the other agencies are doing. If you see back in April, we're now back down to the negative 5. We're not like worse than the negative 37. So we're pretty consistent there. So we are continuing to track our referrals and trying to kind of manage trends. Right now we're still able to see all the referrals that we receive. So, and we're able to visit people on weekends as well. As far as meeting and training,
Janelle, just,
oh, I'm sorry.
That 37%, is that 132 in that column? Is that going up to, comparing it to 2017 of the
Yeah.
same period? So
And you can see, like she said, if you look at the March of 17,
Yep.
the 169, go across and you don't see.
looks
March
pretty
last year was
consistent.
a fluke.
Yeah.
Something
Yeah.
must have happened.
Yeah. Thank you.
Any other questions? Moving right along, meeting and training, we have one of our new nurses that we recently promoted to a full-time maternal child health program nurse position is going to be attending lactation counseling training and certification program in September in Albany, and I've attached the, in the big agenda or the head table, I've attached the document backing that up for her. And that's also on attachment 8. As far as the staffing update, staffing continues to be a challenge and a work in progress. Since our last meeting, have happy news to report for WIC. We were able to select a WIC coordinator nutritionist and WIC assistant. So we are hoping to have them in place by the end of May or early June. Our WIC coordinator nutritionist is moving from 3 hours away, so she's having to secure housing before she can start, but we're hopeful she'll be here soon. And I just still want to reiterate how wonderful the job our WIC staff has done. They haven't missed a beat in this process, being 2 full-time and 2 part-time positions down. So from a service standpoint, our clients have not noticed that there's been a bump at all.
Good.
We will now begin to focus on filling the vacant part-time positions in WIC. One of them is an infant feeding advocate position, and one of them is a part-time nutrition facilitator position. All this is covered within our WIC grant, so we have our intent to fill forms in process for going through. As far as the nursing positions, we continue to have 1 nurse who's out on workers' comp. 2 of our nurses that were on extended medical leave are back. We anticipate a retirement now effective June 30th that Tom was actually alluding to in one of our home care nurses, and that position is revenue generating, so we have got that intent to fill position in process as well. In addition, we promoted one of our public health nurses to supervising public health nurse, so now that intent to fill position is needed to backfill that as well. So as far as the intent to fill, I just kind of like to summarize because it gets confusing with all of our positions. We have the part-time infant feeding advocate, the part-time WIC nutrition facilitator, public health nurse number 8, and community health nurse number 15 positions where the intent to fills are all in process.
I just wanted to say too that the person who's retiring in June has also offered to come back to per diem. So
That makes you happy.
That was great.
On these intent to fill, I need a motion for that. So Supervisor Loeb, seconded by Supervisor Leggett. All those in favor?
Aye.
Opposed? Carried. Thank you.
And then just a tobacco entitlement update. I don't know if you noticed all of our posters hanging in the halls, but our poster contest is over. Our health educator, Dan Durkee, goes into the 4th and 5th grade classrooms of all the Warren County schools, provides tobacco-positive messages, encouraging tobacco-free environments, and then the students then do posters, and then the schools pick their top 3, then they come to the county, and all of our employees get to pick their top ones. And then sometimes we have some that go to the state. But this year we have a 1st, 2nd, and 3rd place, but all the posters were nice. Natalie Zachary from Kensington, she won being 1st place 4 passes to the Great Escape. 2nd place is Kittery Van Gilder from Hadley Luzerne, and she got 2 passes to the fun spot. And then our 3rd place winner is Angela, but it's spelled Angella. Nugent from St. Mary's got a $25 gift card to Target with an anticipation of Toys R Us closing. We're also utilizing the funding for calendars. I don't know if you've seen them in the past, but all the kids' posters end up in the calendar. And then there's positive facts and things on smoking cessation that then are also put in here. And then these go back to the school, to the 4th and 5th graders for their families, so it's kind of reinforcing what we did every January. Oh, yes, you like to keep that, May? I wanted to say Kensington is in my ward, and I think that might be Natalie Zachary.
Oh, okay.
Natalie Zachary.
Okay.
We'll go double check our records. Yeah, I will check that.
And then I just wanted to notify the committee that we had some extra money left over that we're planning on hitting some radio spots starting in June on HIT 95.9, just supporting tobacco-free messaging.
Good idea. Great. Any committee member have anything? Supervisor McDevitt?
Yes, just one quick observation. I've always been deeply impressed with the concern and the emphasis on education as it relates to the, you might say, the negatives of tobacco, and where this ought to occur is where it's occurring right now. We're 4th and 5th grade and taking kids at younger ages, and instructing them, educating them, and getting them into the loop as it comes to just a basic health issue and a quality of life issue. So, kudos to you guys that are involved in that program. On the other side of the equation, and I don't know where this legislation is at this point in time, I am opposed to legislation that raises the age of tobacco. 18 is 18 in my mind. If you can vote at 18, if you can die in Iraq at 18, the age is the age, okay? I don't think that's going to have much of a difference in terms of disincenting human beings to do that. So that's my political statement for the day. And but kudos to you guys at the early end.
Supervisor Bramer?
Thank you. On the training that you have in here for Ms. Porter, has she gone through this training before? This is her first time, because I saw she's getting the book and all this stuff. And I also noticed this in Albany for several nights that she's not staying there, she's coming home and back every day. And do we have this in the budget already? We're not, okay. We're actually very lucky it's in Albany because we're usually sending them to Vermont to spend the night every year. So this is like a first opportunity, at least my tenure that I'm aware of, that it's actually in New York State, an hour away.
Good. Any other committee member have anything? If not, anybody in the audience? Supervisor Conover.
Yeah, I just wanted to reiterate what I said at the last month's meeting, and that is that it appears as if you're tracking pretty close to expenditures in 17, as opposed to what the budget is in 18. That's okay. I mean, that's excellent. Really, it showed like if you look at 2017 revenue total, you can see it showing what, almost $1.2 million more in revenue, is that about right? $1.2 million more in revenue against the 11,163. So it's very important that we'll keep a very close eye on those two columns. If, for example, if expenditures get away from us and the actual rise is significant, but if the revenue, if you look on year-to-date revenue, stays on par, then we're going to have a problem. You know what I'm saying? So 11,163 is okay because it was put against 8.863 on the revenue side. But should that revenue now be 8.863, the revenue should be 7.6 or 7.7. Expenditures stay at 11.163, then we've got a problem.
All right, I'll entertain a motion to adjourn. Supervisor McDevitt, seconded by Supervisor Lowe. All those in favor?
Aye.
Aye. See you next month, same place.
Thank you, lady. Thank you, guys.